right before we were getting started, Dr. Patrick was back here, and you were like, what did you say?
I said, guess what I got this morning?
Guess what I got this morning?
It could have been muffins, groceries,
coffee,
oil change.
Nope, your period.
Yeah, 6 months.
Yeah.
Still breastfeeding full time. It's not quite fair, but
It's
life
not
isn't fair.
Yeah, life isn't fair. But I mean, the point in saying that, because I don't know if you wanted to announce that to everybody on Facebook, is that Doc knows because he knows hormones and he knows women and he understands all of that. And I think better than a lot of women do. And
Yeah.
that's something like even with his hormone connection, learning some of those different things that are supposed to happen every week and what's normal and what's not normal. And then when you talk about pregnancy, it's completely different. And
Yeah.
that's a whole different ball game of going through pregnancy, what that's like for hormones, and then afterwards and having sex.
Yeah. And if you're breastfeeding,
And if you're
you've had
breastfeeding.
complications are all different things. So
Yep.
So
So
let's-
without further ado, we will welcome Dr. Patrick Flynn, the hormone whisperer. But today, welcome, Doc.
Hey, what's
But
happening?
today you're in your scrubs.
I am in my scrubs.
Because today you're a doc doing your favorite thing.
Yes. Well, that's part
favorite
of the
thing at work.
The favorite thing at work.
Favorite
Yes.
thing at work.
We're
You
not
should
talking about sex
clarify.
today. That's right. So
This is
I
true.
actually just got done. I literally got done with a patient 10 minutes ago, and actually it was another doc. And it's a female doc that's having some female issues and stuff. Because I have to always make this clear, even on my show and stuff,
Mm-hmm.
that I don't take new patients, but I do have a heart for doctors that are sick. And stuff, so because I have enough patients that I've had for 20 years, and you guys know as women, once you have somebody that you trust, that you share the most intimate details from your period to everything that way.
You guessed it. She didn't necessarily share it, but
Yeah.
you just know.
Well, actually, knowing her past history, and it's not a joke, and we're going to go into this today, knowing how Bree pushes herself, even though I yell at her all the time, is push herself knowing that she's going to get her hormones kicking back in much quicker than the average woman would. Because once again, because of her personality, because of her work ethic, which I'm always yelling
So
at her.
that stuff affects when
Yeah.
you get your cycle back after pregnancy?
Yeah, it's going to affect how quickly you can have sex after you have a baby too.
Oh, got it.
And so it's like, so it's all tied together. But no doctors think this way. No doctors teach women this stuff. And it's like, because if you don't understand the female anatomy, you don't understand the combination of how everything works. We just did a video that went viral. We did the Swiss watch video.
Yeah. Mm-hmm.
Well, if you think that your mental aspect's not connected to your uterus, you're crazy.
Mm-hmm.
You see
And
what
we
I'm
have
saying?
another short coming out pretty soon.
Yes.
That
Yes.
the happy uterus one.
Yeah.
I
love
saw
that
that
one.
drawing up there.
Yeah, there was a drawing
Yeah.
up there, and I don't know what day it's going to get posted, but even that one, kind of along those same lines of
Yep.
like it's not all clinical as far as what you can do to keep your uterus happy.
Well,
like there are more pieces to it to keep your hormones on track.
Let's look at the medical and natural realm. They both are trying to sell you something.
Mm-hmm.
What I mean by that is, okay, you have these female problems, here's medication. You have these problems, here's your natural things.
Mm-hmm.
I'm sitting there going, okay, they both have some effect, but that's not how you take care of a woman.
Right.
And it's not. And I believe number 5, because I even said this. I have to say this, which is funny. So
Of course.
I'm going through this, and I'm like, Nancy, if I don't emotionally move you by number 5 and see you smile, I'm not going to do this video because I didn't communicate well.
They're
And
like 5 points.
5 points.
Oh.
I did 5 points on
They
how a
didn't
woman
fill
can
me
take care of
in
your
on
uterus. Okay, and no, and that's what I said. But
Well,
yours-
and this is how we record too. Like
But that's
he
in the
doesn't
short.
tell me
The 5 points
this
are
is
in the short?
Yeah.
Okay.
But he doesn't tell me what we're shooting. Like
Nope.
we know the topic, but I don't know like how it's going to be approached really. And
Yep.
usually it's something clinical, and then I get it at the end or something. But for this one, he was like, if I don't have you smiling by the end, I did something wrong. I'm like,
Yep.
okay, this is going to be interesting.
Now I got a quick question.
It worked.
What page are we supposed to be on?
We're on both pages.
Oh, both
Yeah.
pages. I'm like going, wait,
Yeah.
we're on my page too. It's awesome. I'm like,
Yeah, we're
my
on both
Facebook
pages
keeps up
today.
popping up like crazy.
Yes.
So okay, good. So I knew I was like going, it's kind of
Yeah,
awesome.
cool.
So
But anyway, so
Yeah.
I was smiling by the end of that video.
yes, and Nancy's like, and Nancy's first response was, women are going to love this.
Yeah.
But you know something? And it's kind of funny. This topic now, it's really very similar to the same.
Based on your answer, will
Well, I
determine
don't
if
know.
women are going to love it.
Yeah, I was going to say, I don't know. We agree on the 3 to 6 years.
I know.
Does that work?
I know. Exactly.
36 months even.
36 months. 3. Yes. We're going to go into that in detail, okay? Because once again, so I'm speaking at a chiropractic conference this past weekend, and literally it was kind of great because women are coming up to me and because it's interesting because women doctors that are taking care of people don't want to admit that they're sick, so they tell me in private, okay? Which in general, topics that in general women actually suffer with, they don't talk a lot about. And this is something that they don't want to talk about to their man, and so it becomes a little bit of a riff, you know what I'm saying? Because it's like a man really doesn't care that you just pooped out a bowling ball, okay?
It is taboo that people don't talk about it.
They don't.
It's taboo.
See,
I didn't realize that because being in this environment for almost 10 years now,
Yep.
since before I met my husband, I've
Yep.
been in this environment, so it's normal to talk about stuff
yes.
like this.
Yes. Well, that's the thing.
But people don't,
Well,
and
that's
they
the
should.
idea of the hormone connection is saying, and that's why I want everybody to come to the seminar, because the purpose of going, ladies, if all you could do is get the guys to understand you a little bit, it's going to dramatically change your relationship, which in turn, which leads to today, which will dramatically change what he does. And believe it or not, how fast. Here, I will say this right now: the man is hugely responsible to your recovery and how quickly you have sex. See, the women are taking the burden on themselves. I'm telling you right
Right.
now, it's the man that determines it.
Okay.
They say, no, the woman determines when we have sex, but how quickly you heal actually determines on the man.
Because
I can see that.
And I hope I got the audience's
why?
attention. there.
How? What?
I would guess 2 ways,
Emotionally.
physically and emotionally.
Yeah, physically and emotionally.
And I'll
Because
tell
if
you right now.
mom's
Stress.
overdoing it and pushing it, she's not healing.
Right. Is it
Yes.
because of stress?
Well, here, why did Bree get her period today?
I have no idea.
Is it by a chance that I just started back at the gym and now it comes? I mean, is that anything to do with it?
that has something to do with it, but here's this way.
But you're still nursing, so
Bree
isn't that-
doesn't matter, okay? Because here's what happens, okay? If you look at it this way, anytime a woman stresses her body out physically or mentally, the body has to respond. So what happened is when she actually transitioned from being non-pregnant to pregnant, hormone levels shifted that way. And they will maintain a decent level as long as she doesn't go into the high stress. Well, Bree's a freaking AAA personality by herself. Do you say
She disagrees.
Just laid back.
Yeah, she's as laid back as a cactus, okay? So what happens is she's gonna poke you and stuff like that. So, but the idea is this, okay? So therefore, by her nature, by her personality, by her, remember, she went from 16 and pregnant to a CEO of a huge company across the world. So the idea is this, so her mental drive, that's why I think this way. I believe that, once again, I'm trying not to be a stressor. I'm trying to always create the environment in this work environment.
Try harder.
Trying to create, because you know
knew that
why?
was coming.
Because the maintenance of her uterus, the maintenance of her breast tissue, the maintenance of her body is based on her stress levels. If you really think the joke and say, well, wait, she eats organically. Great, eat organically, be mentally stressed out. She's going to drive her
Still
hormones
not,
nuts.
yeah.
Doc, I get adjusted. Doc, I can adjust those women, and all of a sudden, which is fantastic for you. But what happens is, so then when she do that, I'm sitting there going, when she said that, I'm going, well, it's about 6 months. She's been pushing too hard, blah, 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 blah. Her cycle had to come because her hormones started to come back to way her normal defense is. And see, so that's why when I'm guys asked to speak about post-sex, man, in general, get the details. If the guy preps a woman before she has the baby and is extremely preps the woman after she has the baby, her recovery happens so much quicker. Because once again, this is not a joke. The vagina is extremely sensitive to stress. You stress out, blood flow doesn't go there. Blood flow doesn't go there, no repair. If a woman is relaxed, if the woman is emotionally cared for, if the woman is actually has that deep connection, man, blood flow goes down there like you smashed your finger, okay? And it's true. But see, what happens is this. So the guys are like, you know, creating the environment before they have the baby, creating the environment after they have the baby, actually does, and there's other things that there should be done that way. But like I said, so the whole idea is if guys knew that, once again, their recovery wouldn't be 36 months, okay? Their recovery would be...
It sounds so much
All
better
the wives
saying
are now
36
taking their husbands in this
months
video.
instead of 3 years.
Well, but once again, they should be taking their husbands in the video. Because you know what's something?
Because they're the ones that are gonna help.
Sex is extremely easy to get from a woman. Let me say again.
If.
Sex is extremely easy to get to a woman if you can create the environment for them to become a tomcat. Do you understand? If not, guess what happens? You end up living with a bear.
Then it's 3 to 6.
And I don't know anybody wants to sleep with a bear.
years. Right.
look at, no, this is true. See, not one woman disagrees with me right now. Do you understand? See, people are like, no, here's what happens. Because here's what happens. After, let's say a woman, there's a certain healing time, and I'm gonna go over that, okay? But it's extended if a woman's stressed out. It's
Yeah,
extended. And so this whole concept of months and months and months of no sex after pregnancy is because women are not healing properly, because I don't care how, well you eat. If you're so stressed out, a baby in turn is a stress in general.
Yeah.
Do you
And I
understand?
firmly
stress.
believe, I've always believed this, that newborns feed off mom's emotions
By far they
and
do.
hormones through the breast milk
Breast milk and
and
everything.
everything. So, speaking on stress, little sidebar, you're stressed out, so you're not making enough milk.
Right.
Yep.
You're stressed about that.
Then you're stressed about that, and then baby is up either
And you're
trying to
not
make more
sleeping.
milk or because they're getting stress hormones from you, and it's just
And then,
it's
this is
cyclical.
not a joke, a husband be like, will make innuendos like, oh, I got blue balls. And then women by internally, no, but you've all, remember, here, I'm just repeating what women say to me.
Right.
See, that's one thing. People can't say, I love this, because I was actually speaking last week, when I was speaking over in Florida, a woman walked up to me and said, Doc, I've read some bad things about you. I said, what'd you read? Well, people say you're vulgar. So I said, why is it that I say stuff that everybody says internally, but won't go publicly
Yeah,
with it?
because nobody
and
will
I'm the
say it.
vulgar one.
Right.
I'm saying, really? Because women tell me this stuff privately,
Yeah.
and you guys talk
And
about it
I will
privately.
say, the difference with you is it's not somebody standing on a stage assuming this is what women do. You hear this.
You've
for-
heard it.
I
Yeah, you've
I'm
heard
a
it.
doc this
Yeah.
morning.
Yeah.
I heard this.
Yeah.
I just got on the phone with a doc that was telling me the deepest aspects of what's going on with her physically that way and the boobs and stuff like that. It's like, listen, it's normal. It's like, okay,
Right.
I'm trying to help her boobs be normal. I'm trying to help everything be normal that way. And so I'm like going. So I tell people, I say, listen. So if a guy says, hey, I'm starting to get blue balls, a woman internalized that. You
Right.
guys feel bad.
Sure.
Oh,
I'm never gonna watch. Well, that's your AAA personality.
That's you-
You're
that's
like,
just you.
You're like, jingle bells, okay? But the idea is this. But you think about it this way. I want you to think about this. But most women, Bree's the exception, but she acts all tough. But Bree has a heart of gold, okay? She cares about her husband deeply. And by nature, women internalize that and feel bad. And I'm like going, guys, don't make her feel bad. Blood flow's not going down to the vajayjay if you do that. Do you understand? You want to bring that.
So
Right,
let's
so
say
you have to
husband is doing
control
all
what you're
that.
saying.
Yes, now
Yeah.
there's other factors. Remember, that's one.
Right.
So I just think here's what happens. So a guy should set the environment pre-pregnancy, or pre-delivery that way.
Right.
Because once again, birth itself is extremely tough, okay? Even a healthy birth is actually tough. That's why guys don't have babies. Heck, if I have a hard poop, I'm done in 2 minutes. You talk about pooping out a huge baby, okay?
not-
I'm like, oh,
Reference to baby
I know, I'm
poop.
like, oh, this poop hurts. I'm gonna hold it in for a while. You know what I'm saying? But the idea is this. So then going through that is tough. Now, once again, if you look at what delays recovery, what happens, people don't realize this. If you have an episiotomy, what they do is they cut the perineum from the vagina to the rectum, okay? So really what happens is, if you look at birth, the perineum actually takes the most damage. So then how can you prep that perineum to change the easiest before the baby is there? And that's keeping it very moist. I love that
I
word.
told you this show wouldn't be dry.
Oh, wow, Nancy.
You,
Wow. That was good,
It's
Nancy.
humorous.
It's humorous.
That's what I mean.
Yes. Now, wow, you're on a
Not
roll.
dry.
But no. So keeping the perineum,
Now
keeping the
she's red.
I
labia,
am.
keeping the whole vagina, and actually towards the rectum moist. And that's what I tell people. If you're not allergic to coconut oil, but there should be some oil applied vaginally every single day. Do you understand? Every day. Why? Because it's going to allow the perineum to stretch properly and do everything. And once again, then you need to actually make sure your collagen levels are great. Make sure you're getting enough vitamin C. Your body uses so much vitamin C when it comes to actually your adrenals. And the stress of a baby and the stress that way. That's why we love bone broth. That's why we love eating bone broth. That's why we love doing those things. Collagen is very good for its bounce back repair, okay? So the perineum, for example, could take such a beating that what happens is that's what's inflamed. That's what's inflamed, okay? So that's why, once again, that when that expansion happens, it's not, see, people don't realize. People say, well, Doc, it would happen more towards clitoris. No, it won't. The pubic bone stops it from moving forward. So it has to go backwards. So what does it do? It stretches that perineum towards the rectum. That's why you see, ask some women, they'll say, Doc, when I'm delivering birth, it feels like my rectum is on fire. Yeah, because it's pushing back towards it because it can't go forward. It actually protects the clitoris and protects the vulva and stuff, so then it goes backwards. But see, you can prep that by keeping that whole area moist all the way, especially the last 3 months of pregnancy.
Yeah, I was actually, side story. So my first was a C-section. My second,
Is this my water?
Yes.
Oh,
Yes.
okay.
my second was I had an episiotomy. So I was actually, I had, very medical,
Yep.
cesarean, emergency C-section, and then my crunchy birth, as we like to
Yep.
talk about it.
Yeah.
All these books say
Can't
perineal
wrap
massage and all this stuff, right? I'm like, it's a little too crunchy for me. They say, take your essential oils, take it. No. Okay, so I had episiotomy with Jace.
Yep.
my recovery was, heck, it sucked.
Yep.
And I mean, the doctor basically they cut me. So he had long hair, and his head would keep coming out
Yep.
and going back in, and like, we're gonna have to cut you. And my doula said, I agree. Okay, so they did the quick episiotomy. He was delivered. My third, I delivered up, actually in Rhinelander,
middle of nowhere.
in middle of nowhere, and I had a OB that was, she's probably in her 70s. I
Yeah.
am not
Yeah.
exaggerating.
So
She
did
was
old-time
traditional,
birth.
yeah,
Old
yeah,
school.
very old school.
And we've talked about this on one of the other shows, but she was literally, I lay down, or it was crazy, fast birth, and she's like stretching it.
Yeah.
I mean, she's down there, and I'm, stop it.
I like her.
It was phenomenal after the fact, I said. It hurt like heck. I did not have to have an episiotomy.
Yep.
I did tear,
Yep.
and I did get stitches. So both times I had stitches. One was an episiotomy,
Yep.
one was a natural tear. My healing time frame from
Dramatically
the two
short.
of them, dramatically shorter,
Yeah.
way less pain. I never did any Tylenol, any Advil. I was
Yep.
living on, and I don't ever take that stuff.
Yep.
With my episiotomy, it hurt like heck.
Yep.
And all those books I read, they're like, yeah, massage it, keep it moist, keep it wet. It's like, oh, that's why they said that.
Yeah.
Yeah.
Because you didn't do it. Yeah.
Because
Yep.
I didn't do it.
Yeah.
I thought, nah, that's not necessary. Well, then
It's
she
extremely
did
necessary.
it for me.
Yes.
And I started to do more of that with the third, and it was game changer.
It's extremely necessary because it's still a very elastic tissue. Do you understand? And it can, and that's why a lot of women, I've had what you guys seen the emails, I've had women say, you've seen it, where, I had a birth and now it's not elastic back. Yeah, because if you take a dry rubber band and stretch it, it never goes back to where it's supposed to be. No joke. If you take a rubber band and throw it in a little glass of water, it actually gets better. Actually makes it actually more elastic that way.
good visual.
And so the idea
That
is
is
this, so you got it, and that's why I say, but that starts before you have the baby. Now let's say, guys, Doc,
Right.
wait, no, I just had my baby last week, what do? Well, remember, go back to this. So apply some oil. Now you say, Doc, but I'm allergic to coconut oil, then use avocado oil. If you
There's
look
other
at
options
coconut,
besides that.
avocado oil, they're very, very similar to our skin. Make sure to get high vitamin C-based foods. That's why I love Camel. You can buy that on Amazon, you can buy it in any health food store. It's just the best, highest vitamin C-based food on the planet.
Not orange juice?
Orange juice will actually make you sick. Okay, don't drink orange juice.
I feel like people just assume like, oh, I should drink
High
orange
vitamin
juice
C, yeah.
because it has
Well,
vitamin
it's
The
really
sugar
funny.
content-
The sugar
the
content
sugar
will make
is
you
what's
sick as
bad,
can be.
yeah.
Well, but I mean that. There's not much. Once you actually, most even organic orange juice is heated. It's heated.
So you lose all the
So you lose all the vitamin C
vitamins?
anyways. Okay. So you're just really drinking sugar. Okay.
So camu, vitamin C, collagen.
Collagen. Now here's what happens. There are some essential oils, but don't put them directly on the vaginal tissue. Because I had one woman. I told her. I said, listen, oils can be concentrated oils from plant can be very, very potent.
Sure.
So I'm like, listen, okay. I said, jump in the bathtub, warm bathtub, put some lavender in there, put some Epsom salts in there.
Bath water.
And throw in the bath water and soak the mama parts in there for a while, okay? So it happens this, and all of a sudden it was hilarious because all of a sudden she gets emails, she's like, Doc, it's burning. I'm like, what's burning? And so she Facebooked me, and I'm like, she goes, my vajayjay. And I said, well, what'd you do? I said, she goes, I put oil on it. I'm like,
Oh, no.
I said, coconut oil doesn't burn. She goes, no, I put lavender oil directly on it. I'm like, jump in the tub, it's burning. And I'm like, and she
it
did.
off.
She's like, and I texted her, I said, I messaged her back and said, why did you put it? She goes, oh, I thought since it was in the water, it'd be okay if I just applied it. I said, no, don't put that directly on your skin that way. It's got to be diluted that way.
Yeah,
So
you can mix them with oils or fractions
Yeah.
of coconut oil or anything.
Yes.
Make a spray.
You can actually diffuse it too.
Yeah.
You can, now, you don't want to squat over your diffuser and stuff like that, but you can diffuse
Trying
it.
to picture that.
They actually have steam seats. I ever taught you guys that?
Steamed seats.
No. They actually have seats that you sit on that have an opening to actually let your parts go through,
I've seen
and then you
that.
can diffuse
No.
from that. It's not a
That's
joke.
way too crunchy for me.
I'll take the bathtub.
Well, see, that's a lot of
There's
people.
the crunchy
A lot of people are
skin.
saying,
Yeah.
Doc, you never teach this stuff. Well, I gotta get people to I gotta get people to not
Do-
eat sugar.
right, to do the
I gotta
basic,
get people
not-
to I gotta
not
people to
drink
say,
orange juice, right.
I mean, do you understand? I have women that tell me they're like, Doc, I'm so grossed out because you said put coconut on my vagina. I'm like, yeah, but you complain about painful sex then.
Right, then don't complain.
Then don't
Do it-
complain.
do it or don't complain.
You say,
Right.
okay, so let's go back to that. So
Yeah.
so you're now remember. So but let's go back to here. Okay. So when you look at actually reducing inflammation that way, remember it's extremely important post pregnancy to not be inflamed. Do you see what I'm saying? Because I know a lot of women what they do is they get post-pregnancy and they're just like, I'm just beat up. I just want to eat anything I want.
Right.
I'm nursing.
Be careful.
Yeah, I'm
Nursing,
hungry. You have to eat a lot
it's
'cause you're
I'm like,
hungry.
no, listen, because all that stuff slows your repair process down that way. So yes, apply things on directly that way. It does make a big difference. But remember, keep your systemic inflammation down. It's too important for you to heal up. Now, Daron, so I want you to imagine this. So take my beautiful bride, for example. Man, and people say, Doc, you're such a caring man. No, I'm not. I'm just
Yeah,
like the other
yeah,
guys.
I know.
I got blue balls, and I get testosterone.
so caring.
And I'm not caring. God, ladies, I'm not a caring individual.
You do have good intentions behind your caring.
No, I don't. I want
For
sex.
yourself.
Yeah, for my sex. It's all selfish. But see, that's why God created it. I'm selfish,
right.
but I don't say to my wife, come on now, it's been 2 weeks since we had sex, and therefore, no. I say, listen, I'm going to do everything I can as a real man. See, that's why I love when people say,
right.
I'm a 1950s man. That was one of the quotes on the book that way. I'm like, no. I'm a man that understands how my wife's body, how every woman's body works that way. And I'm going to set the environment for my wife to heal pre-delivery and post-delivery. And for what purpose? I'm just as nuts and crazy sexually driven as your husband is. I just understand how a woman's body works.
Right.
And so I want to benefit from what her body gives me, okay? And it's not like I care so much. Guys, ladies, I don't care that much. You know what I'm saying? I know it sounds funny because you guys want to be like, he does that because he loves his wife. No, I do it because I'm a good husband and I understand him. But now I
Because
deeply
you know
love my
what to
wife.
do,
Okay,
right.
don't. But I'm telling
twist
people,
it,
yeah, because people say, well, look, watch Doc, he's just such a good guy. No, I'm doing it because of the benefit at the end.
Right.
You know what I'm saying?
Yeah.
But see, that's what happens. And if that conversation, man, if I was a woman, I'd be like, listen, if you don't understand how this works, you know what I'm saying? Putting stress on me gets you nowhere.
Right.
And then what guys will do, instead of actually going, okay, they pulled the man card, the 1950s man card. Well, I provide for the family and blah, 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 blah. Ladies, I'll ask you a question. How much does that
1950s
work?
man card.
Do you say? Women go,
It doesn't.
doesn't. No. But you know something? But if he shows up and do what's right and actually said, listen, and sets you an environment that actually you feel deeply connected to and loved to that way, man, guess what? The repair, everything actually happens so much faster. And I've literally sat from women and I literally sat there and women sit there and go, Doc, my husband is giving me a guilt trip because it's 8 weeks and we haven't had sex yet. Okay? Now, ladies,
That's
let me
not
tell you this though.
benefiting anyone. Yeah.
If you look at just a repair process, if everything goes right, the inflammatory process to repair takes about 6 to 8 weeks. It takes about 6 to 8 weeks.
6 to 8 months?
6 to 8 weeks.
Is that what you said?
So you know what happens? So, and that's if everything goes right. With a little tear, it's longer. With the episiotomy,
With
it's longer.
extra stretching, is it longer?
Well,
Shorter.
It's shorter actually.
It's way shorter.
Oh, 'cause
she
of
was
the-
having
Remember,
a field
guess
day
what
up in
happens?
there in that third birth,
Oh,
and it was
yeah.
way shorter.
Do you ever? Yeah, so I finally watched the football game yesterday because there's people over because he had some friends over and everything. Because you guys are friends or watching
Okay,
commercials.
yeah, it's
What a
that's
bad.
so not.
I mean,
It
the
was
commercials
so boring.
sucked. You know what I'm saying? And I mean, the commercials are so political. You know what I'm saying? It's kind of hilarious watching some of those.
Someday we'll do a commercial during
gonna
the
do-
Super Bowl, right?
For $5 million? Hell no! I'll spend the money on Facebook. You know what I'm saying? And it's like, but no.
So you watched football yesterday?
No, I actually fell asleep a little bit too.
Oh, okay.
Remember, I just got home from traveling that way. So Christy's friends, everything, we're kind of sitting around like in the chair that way because yeah, it was kind of fun. But what the hell was my point?
I don't
I was
remember.
wondering that.
I don't remember.
No, we watched the football
I
game,
knew what it
but I
was.
did watch. I was actually playing. We played a game. I was playing a game with my daughters and stuff like that. We were playing a board game, and all of a sudden I looked at TV, and it was pregame, and all of the players were stretching out and preparing.
Right.
Guys, your pregnant wife is the game that the field that you want to play on. It's time to stretch it out. It's time to actually do the things to create that emotional aspect for you to score.
To score.
He was
Nice.
waiting to use this
I was waiting for
all
that one.
day.
That was perfect.
So
So 6 to 8 weeks is what you would say as a doctor.
yes. That's if everything goes right.
Right.
That's if your husband does things right. That's if everything in birth goes right. And see, guys need to know that. Well, who's going to teach them that? Their OB?
No, not teach the guys.
No,
So
but
tag your husband.
yeah. Well, that's it.
Take the baby daddy.
If everything goes right, that means the guy does his pre and post job. That means there's no tears. That means that way 6 to 8 weeks. Do you know what I'm saying?
So I want to talk a little bit about how the hormones change
Dramatically.
from when you have the baby, when
Yes.
you're pregnant to after the baby. But I'm also curious about C-sections because you had a C-section. I had 4 C-sections.
Yep.
How does that affect all of this?
Okay.
Like as far as the hormones and the
C-section
sex after baby.
changes the cascade of hormone release after the baby's born. So that's why a lot of women during C-section they don't get a high oxytocin release, and they're like, "Doc, I feel disconnected." Well, yeah, because that change, and when it comes through vaginally that way, there is a estrogen and progesterone change that way that now releases, and that's why you even see milk production is different compared to when you do it vaginally compared to when you do it actually during C-section. And so, but once again, that's why when you actually, if you do have a C-section, once again, I see there's women that need to have C-sections. I've even seen things go extremely well, people doing the right things, and because birth itself. So I don't have a problem with certain emergency services that way. I just believe most emergency services can be avoided, if things are done
We've
right.
talked about that on the show. I
Because
believe
mine
my
was-
high stress pregnancy and
Yes.
not knowing any of this, being under your care,
Yep.
I mean,
Right.
is why I had a C-section. I do believe there's a time and a place. I believe
Yep.
100% mine was not
Yep.
necessary if I would have known the true
Yeah.
steps.
Mine,
to
mine was
take.
just convenient for the doctor.
Yeah.
Because it was a Thursday.
Yep.
And I was induced for like a week.
Yep.
So
Well,
let's
and
just do
that's
it.
why C-sections are
But
becoming
it
more.
happened. I'm still wrong.
Yeah.
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 No,
the
you're just kind
doctors
of at
say,
the mercy
well, I've got
of what
plans
they
to be in
suggest.
Minnesota in
Yeah.
2 days. So
Exactly. And so
you know.
their plans interfere
Yeah.
with what's going to happen that way. So
So how does that affect the sex part after baby? Obviously, you had a surgery, so
you have surgery. Well, man, my goodness, man. And the worst part is you actually cut open
It's
the uterus.
considered a
right?
major surgery.
It's a major
isn't it?
surgery.
Yeah.
But see, what they have done now, they've become good at it. See, medical procedures over the last 50 years have gotten good at it.
Gotten
There's
better.
things that you could die from 50 years, you can't die from today because they're good at it. So what they did is become convenient to do C-sections, except for, once again, you cut through so many layers, there is a dramatic recovery process that way. And people say, well, doc, nothing happened vaginally. Guys, listen, if a woman has a sliver, it affects her vagina. Do you understand? It does. Anything
Well,
that
I
stresses
mean,
the
if a
body
man
out,
has a headache, he's on the couch for 8 days.
right.
The flu, the man flu.
the man flu.
So true.
No, but this is the one thing I can honestly
days.
tell you. I can honestly tell you, and you guys can validate this, okay? I'm always trying to do everything as a husband to keep stress down
Right.
for a woman. Do you know why? Because I want the best working out of you. I want the best work out of you. I want the best work out of all the women sitting here and stuff of them. I want you because women thrive in every aspect of life in a great environment. And I believe, now here's my 1950s man thing come up. I believe that it's my job as the man to create that environment at home for Christy to thrive.
Right.
So she can be every aspect of the way. I believe me as actually owning this whole company across the country that way. That's my job to actually create the best environment because you know something? That's why I love when people say I'm sexist. I'm like, really? I have a CEO woman. I have another CEO woman. I have
Yeah.
more female employees than I ever have male employees. I'm trying to just create the environment. So when I yell at her in a good way saying, forget about this stuff, who cares?
Yeah.
And she'd be like, no, you got to care. No, I do care. I just don't want you to care.
Yeah.
You
Or go
understand?
home at 3 o'clock if you're supposed to go
Yes.
home at 3 o'clock.
Yes. Well, yeah, I'm like, because why?
Kim or
because
whoever.
that's where for example, listen, so when I come home, once again, regardless of how the kids are driving my wife nuts,
Right.
because kids are stressful,
Right.
I'm going to be like, kids, guess what? You stress mama, you're going to get a butt kicking from me.
Right, because
You
then you
understand?
don't get what you want.
Yeah, that's it.
So
See,
that's your motivation behind
Guys.
getting the kids to behave.
yes.
It's all connected.
I love this. Women are so stressed out, doing everything like crazy, and a guy who can actually not think about anything, even though hear everything that way, and all of a sudden he's like, go to bed, guess what happens? Girl's totally stressed out, and he's like, hey, baby. And she's like, what the hell? Not happening, and
Right.
stuff. So, yes. So, Ross just walked in with one of our newest docs and stuff.
So let's say you've done all this stuff. You've had a healthy vaginal birth.
Yes.
You've added in the coconut oil. You figured it out.
Waited the 3 to 6
Waited
months,
3 to 6 years. Just kidding.
months, years.
The 6 to 8 and it's still. What's the next step? Because they've done all these things. Now what?
have sex.
And they still don't have the desire. Their hormones are still in
okay.
the
I
tank.
get what you're saying now. Okay,
So
you're
they-
saying
I'm like,
she has
come
no
on,
you
desire.
know.
Okay, no. Get this. No,
On her
no.
end, she doesn't have that.
So let's say this.
Even if he did everything right.
Exactly. No. If he does everything right, so let's say he does everything right, then what happens is her body physically is not recovering. Do you understand?
Okay.
That means her hormone levels are not coming up enough that way. Because once again, that's what, see, I have men go, Doc, I am a good husband. And my wife doesn't respond. Yeah, she's sick inside. You need to get her levels tested. And they're usually tanked.
And that's what you see so often.
Every day.
Doing your
I
clinical
remember,
stuff.
it's driving me nuts. And since we're on my page 2 and the Wellness Way page, mean this. People see me going and speaking all over the country. I do that because I have a unique message. What I have to start telling people this. I'm a clinician. That's what I do. I'm a doc. I want to delve in and figure out what nobody has figured out. That's why the Wellness Way doctors all across the country are so special. Because what happens, we come at it from a different direction. We're initial, because I am obsessive about figuring these problems out.
Right.
That's what made me, remember, this whole thing started from a dead-end warehouse, and I was broke and had nothing. And then what happens, but we start to figure out and see things differently, and then sharing it with the world, and that's why it's become, and yes, then people say, Doc, can you come speak? Yeah, but I'm not a speaker.
Right.
Well, Doc, I love your seminar, I'm funny. Well, who cares?
Yeah.
But I still like to get into the aspect of, let's test that woman, that the guy did everything right, and she's not responding. She's sick inside. She's sick inside. Do you
And
understand?
so-
But I
the-
think that's comforting for moms.
Right.
You've done this, you've tried this, you added
You're
the
not
coconut oil, you
broken.
added the maca,
Yeah.
you're not broken.
Nope.
But I feel what they like to do now in Western medicine is, you've got postpartum, here, take some Zoloft.
Oh, right. That's so
and
common now.
here's what I say, is I would say,
She just had a
you're
baby
right.
and her hormones-
She might have
She's stressed out.
postpartum, but I will say this.
But all that is going to do, I'm not poo-pooing on
We see-
postpartum,
well, no,
and
you've-
we'll
you've been
probably
here-
do
you
an
worked the front
episode
enough
on
for a
that.
long time. Remember,
but
Bree worked the
there's
front for a
other
long time.
options in covering it up with Prozac
Right.
and Zoloft.
Right.
Well, yeah, because
Because-
that actually goes to the baby. Those medications go to the baby.
Yeah.
That should scare the hell out of a mom. You saying?
Right, yeah. That should be
So-
reason enough not to want to take that
Yeah.
stuff. But get
So
tested
not
to
bad if
find
you
out what's...
are, but
Right.
there's
Yes.
other options.
Right.
It's huge.
Yes,
Well, remember,
postpartum is real. You've got to figure it out.
Right. And
Yes.
we have a show coming up.
We do.
in a,
Yeah,
in a
we'll
few
do
weeks
that
talking
on a full
about-
show, but
yeah.
there's other options.
Talking about
there's a lot of
that.
options.
Yeah.
So,
So, their hormones.
how's our comments
guys doing
going there, Brianna?
everything. Hormones are off.
Is any ladies being offended from me saying vagina or something?
No, everyone's loving it.
Okay, good.
Someone wants to know how they can get their husband to read your book.
It's ladies. Look at what
Hold out until he reads it.
you have, the greatest marketing
There
tool
you
on the
go.
planet.
I mean, seriously.
You heard it here first.
Yes.
Just kidding.
No, don't use
And if
sex
they don't
as a
wanna
power
read,
tool. What's
They
that?
don't want to read.
Yeah.
They can see the seminar, which is the first time ever we are doing it
Live
May,
across the world.
online. So May
Yeah,
17th,
May
we haven't
17th.
talked about it on our New Mom Monday yet.
Nope.
So Wes has seen the Hormone Connection 11, 12 times from
And you're gonna
Green
make
Bay
him
to
come again?
Hawaii.
Yeah.
And he needs, based on his progress, he maybe should see it about 12 more times.
Yes, but how many
Right.
times has he come to you and said, well, remember, Doc Patrick said this?
My favorite is,
Right. Yeah. He's
Patrick
done that.
says you can't wear that to bed.
Yeah. Right.
Yes.
I get on both on the phone. If I have
She
to hear it,
texted me.
either of you
Let's just try to use your information against
Yeah.
me. I said, well,
So,
then
yeah,
he's
well,
right.
Patrick says
Then
you
he's
can't
right.
do that either.
Yes, yes. But
But-
here's the cool thing is, it's actually a topic, though. It becomes a discussion
Right.
between
And
husband
then
and
you
wife.
talk about it. So
Yes.
then it's something
But
that comes up
there's
in
key
conversation.
things that we go through the lists in the seminar. I'm a list person, of
Yep.
course.
The
so
list.
got the guys list and the girls list,
Yep.
and don't feed the boy, all
Yep.
different kinds of stuff. We won't get into that because that's your.
But
your
I've
huge
actually
seminar.
added
your
some
thing.
things for people that have seen
Yes,
it.
added
Trust
some
me,
things.
we
There's
got some.
some key things that you go, oh, I'm doing that. Oh, never thought about that. Okay, it's really important that I
Yep.
don't
Right.
wear my Snuggie to bed. I didn't realize it was that big of a deal.
You know what's really funny?
I don't have a Snuggie, but
So
if I did,
get this. So I did a little investigation because Snuggies don't exist anymore, and I use this at my seminar now.
there's one in my basement.
Yes.
Right there.
Now get this though. Get this.
Right.
A Snuggie was not invented by a man. Actually, it
Of
was a
course
woman.
not.
That's my point. I use that. I'm
All
like,
good
ladies.
things are
there's
invented by
Snuggie."
women.
Right.
No,
yeah.
no, good things. That thing's horrible. You know what I'm saying? It's like, because I'm like going, because I want to do a little bit, because all of a sudden I'm speaking, I use a different
The
example one time,
shoulder blade.
but then all of a sudden I'm like, wait, I see women wear Snuggies. I'm like, so I looked it up. It was actually created by a woman. That was cold.
course,
And stuff that, I'm like going, well, of course, because you're all bundled up, and the guy's like, I can't see your boobies that way and stuff. So it's like, yeah, it's kind of funny.
We used to have a battle that the heat.
I was just
typical
gonna
men
talk
and
about
women
that.
thing.
This is so funny.
I like the house at 70 to 72. Men all like it 65,
I like it warm.
68.
Well, we know you like it warm
Well,
because it's
'Cause then Christy
usually
runs
like
around
77
exactly.
here.
Exactly. I was just
Right.
saying, I figured out exactly how to win the argument.
Yes.
If I don't want it at 65, I want it at 70. You're going to wear your summer pajamas if I keep the house at 70? Honey, you can keep the house at 72.
Right,
That's right.
I can keep it
exactly.
as warm as I
We just had
That's
that
it.
conversation.
That's
I'm
the
not
thing.
going to wear a hoodie to bed if it's warmer than 65 degrees. in
That
the
thing
house.
was not a
See, you
hoodie.
get it?
No,
That was a
That was a Burko.
garbage
No, did
bag
you
with a
show
hood.
him?
No,
I
but
haven't.
it was bad.
I'm like,
we
how
need
do
to
you
show
know?
people.
No.
No, but that's
We're
the
not
point.
showing people.
See,
Got
you
your
just
back.
you just won. See, ladies, you
Kim
just
said
won.
it wasn't that ugly. So
But guess
She
what?
was being nice.
The bride's
was
like,
being
well, I don't want the heat hot. Well, do you want Nancy to walk around in a tank top?
Right.
Yes. Then turn the heat up.
turn the heat up.
Do you know what I'm saying? But see, you won. But did you win because you're a nice girl? No. You have the
Right,
boobies that he
right.
wants to see. Get my point? No, it's true. Ladies, I don't understand how ladies go, I can't get my husband to do something. My wife can virtually get me to do anything she wants.
Yeah.
Even if I don't want to do it. You know what I'm saying? It's like, it's that simple. And then it's like, oh my goodness, I just laugh at
It's
this.
that simple.
Yeah, so there's all the things in the Hormone Connection
Yes.
seminar. And we have
Lots of
our
good
big one
things.
coming up May 17th. We
Yep.
haven't talked about it on the show yet.
But
Tons
it's going
of
to be
new
live
stuff
online.
added.
Yeah.
We're doing it first time ever, probably the last time in a long time. It's
Yep.
not going to live out there. We're
Nope.
doing it live.
Right.
Do it live.
So they can go to that, and Brianna will link it
Actually,
in
it's
the
kind of
comments.
cool. We'll be having events
So if
during the
you're in
night
the
all
area,
over the world.
Yeah,
It's
that's
kinda
gonna be
cool.
awesome, right.
We've got fun games, all different kind of stuff.
Yes.
So if they won't read the book, that's the question that came up of how do I get my husband to read the book? If they won't read the book,
Yep.
come to
Get
the
him to
date
watch the
night. It'll
event,
be
yeah.
fun. We're gonna
Well,
have
he wants the
fun
event.
stuff.
Then say, no event, no sex later at night.
Right. It's that easy.
It's that easy. Do you know what I'm saying?
And the
It's-
guys love it.
That's the point.
They
Well, I
walk
think
away
The
loving
guys,
it.
Yeah.
actually, if you're a guy right now,
Yeah.
if your husband, if you've been to the Hormone Connection seminar, or actually your husband watched it and they've been to one, please comment below and tell them just, did your husband love it or not? And I've never once.
The guys love it. And I've traveled with you a little bit in the
Yes.
last year to Hormone Connection events. And I'm
Of all
always.
And tomorrow.
ages.
It's so
Of all
fun.
ages.
Yeah.
They love
Oh,
it.
yeah, of
From-
all ages.
yeah.
Yeah. Yeah, and the guys always love it.
Because
and
you know
actually,
why? They think
yeah.
that I'm some girly guy.
Right.
They think that I'm going to come along and say,
Right.
I'd say like, oh, just no.
Or that it's like this one-sided conversation. It's
Well,
not a
that's
one-sided.
what most marriage seminars are.
Right,
That's
exactly.
what most hormone things are.
Yeah.
It's like, no, we have testosterone.
Yeah, and it's not like a touchy-feely. I mean, there are emotional parts to it, but
Yes.
it's not like a sit here and listen to you tell
No,
me
it's
about how I'm
interactive.
wrong
It's
or
very-
whatever. It's
exactly.
not that way at all.
So now we got it.
Yeah.
It's pretty awesome.
Yeah, it's gonna be good. May 17th.
So we didn't think about talking about it today, but just
There we
There
go.
you go.
Led
now,
right in.
Now you know.
Yes.
Yeah.
So there we go.
Okay,
So,
what else
so
do
we
we
covered
have?
we
Yeah.
covered everything from crunchy mom's vagina, to basic stuff that way to repair. Well, steam, you know,
just thinking
diffusing.
crunchy vagina. Doesn't
Crunchy
sound
vagina.
very good.
Crunchy vagina.
No, you don't want that. You want moist vagina. Okay. So, yes,
Yeah,
but
yeah.
that's how you do it. So pre baby, post baby. There's action steps you can take. But on the flip side, forget pregnancy alone. Without good connection from the man,
Right.
without good balanced hormones, without applying things vaginally, guess what happens? It's tougher for a woman.
Yeah.
So I said, it's kind of funny. My little girls, for example, understand that, once again, obviously they're going to have no connection to a man because they're young, but they can still take care of their vaginal health. What doctors teaching the mom to tell the daughters what to do with their vaginal health? Nobody.
Yeah, nobody is.
Nobody is. And so therefore, they end up with all these problems at a young age that don't need to be there.
Ugh, the kids coming in with. Remember that one little girl? She was 6 and had her period.
Yep.
How do you teach a
Yes.
6-year-old
Look at
what
this.
to do?
That's
with
not a joke.
her
I don't
head?
think a lot
moms
of
don't
so
know,
remember, let me say this
then
again.
they
I
don't
said
teach
before.
their kids either.
Brianna, Bree
Moms
worked.
don't.
Bree and Kim, which are my two CEOs that way. They worked the front. They started as working the front desk.
Right.
And then they grew individually as their self, and that's why they become CEOs of huge companies now. And what happened is, so she worked the front desk. She was there when you walked in. When I was just mainly just a clinician back then. I owned a couple offices, things like that. What happened is, you're right. I've had a girl that was 6 years old that started a period. I've had 8 and 10 and 9-year-olds that way that start their period. That's not supposed to be like that.
That's not normal.
And what they do is this, and then
That's
they try
not
to
normal.
medically induce them back into being non-cyclic with hormone therapy. You're setting that young girl up for cancers and all
Cancer.
our parts of things that way. And it's like, and guess what happens? But what other doctors know what to do? There's no natural doctor, there's no functional medicine, there's integrative. That's why the Wellness Way doctors thrive. We were to be able to figure out the things that nobody, that's why being a doc, I love what you say. You love what we say because, once again, it makes complete sense, but then physiologically, it actually gets the results. And once again, that's why we were I was talking to the doc before. I know I use it a lot, but I think it's still funny. I was talking to the doc, I just got followed up before I ran here. I said, Doc, do you really think the Wellness Way is so busy because I'm so damn good looking?
Yes.
If it is, we need, oh, Nancy, thank you.
Suck up.
That's right.
I did that
She
on
just
purpose.
made me
Did
feel
you get
good.
glasses? Where did Nancy put her glasses?
Wow.
She was yelling at me before the show about that even.
It's no, we'd
I
be
mean,
broke.
you look great.
Yes, thank you. We'd be broke. No, we do it because of the results that we get. And here's the cool thing is
Right.
this. So we can sit up and spout off all we want here.
Right.
You don't get clinical results, guess what happens? No one will believe one word you say. No one will. So yeah, because we have nothing
Yeah.
to sell you. What have we sold them on here? I don't own
Nothing.
coconut oil factory. I don't own things
Not
like
yet.
that.
That's a good idea. Yeah.
Yeah, forget the jet.
Big-
Let's open
yeah.
it.
And let's call it we can actually create a product that's just for vagina and just put the same coconut oil put on your face. This is vagina
People say
coconut
to me,
oil.
Wait,
so
it's
where
the
do
same
you
exact
keep
thing.
coconut oil? I'm like, everywhere.
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 Diaper rash
Yeah.
cream,
Oh, my Finn-
bathroom.
Finley was
Cook
so
with
cute
it.
the other
and we
night.
keep different jars in
Yep.
different
He
places.
requested coconut
Yep.
oil. Like I changed his diaper and he was like, I need oil. I need
Yep.
oil. I'm like, okay.
Yep. Oh, wait! I just saw this. This is not a joke. I know my husband has hormone issues. He has no sex drive threat. When no sex doesn't do anything. You're right.
No, right.
That means this
test
happens
him.
all the time. They have low hormones, and the sad part is this: men never talk about it.
No. And they won't
You know
say
what I'm saying?
anything about
No
it. They
men.
won't.
You've got an awesome testosterone video.
Yes, I do.
We'll have Brianna take
We can
that
link
to
that,
this
yeah,
lady's
on
comment.
YouTube.
Yeah.
Yes, because here's what happens is
Get 'em tested.
Because women will really walk up to women and say, "Doc, my boobs hurt." This. No guy likes to walk up to another guy and say, "Hey, dude, I can't get erection."
Right.
It doesn't happen. Women, because they're so open about emotionally trying to look for help. Guys, man, our testosterone goes low. We lose our drive, our motivation, their sex drive that way, and they can have a drop-dead gorgeous wife, and guess what happens?
It doesn't
You know what I'm
make a difference.
saying? This woman probably does everything right if she's been watching us for a while, and it's like, and she already probably listened, no sex, and he's like, ugh. And they're going,
Mm-hmm.
no joke. It's like that guy once again, but he won't admit he's sick. No, I'm tired. You're not supposed to be tired.
Okay, so how do you approach that then? Like how would she approach that if she's the one? Because normally it's the other way around, right?
You know what's really happening?
Normally the guys
That's
want
what
sex
everybody
and the girls
thinks.
don't.
It's not.
But it's not necessarily.
Right now, because men have taken high amounts of statin drugs, and guys are so sick now, and they're getting sick at
So
such
it's
a young
the
age that way.
opposite.
I'm actually, once again, I can honestly say this. I'm starting to see women complain that they sometimes don't get enough sex now. And I'm like going, and it's really funny. It's like going, oh my goodness. I'm like, and my heart breaks because it's easy for you guys to come to me and say, hey, listen, my cycle's okay, what can I do? But then when a guy doesn't even want to admit to his wife. A guy will use the excuse of, honey, you know I've been working hard.
Right,
Honey, I've
yeah.
been doing this. Honey, and I'm not saying that he's not. I'm not saying he's not even a good man that way. I'm just saying, for example, if he's not, trying to grab your butt every day, something's wrong. Here, where was my best friend? Where's Ross over here? Come here. Now, Ross, my best friend, we talk about this all the time. He's married, I'm married. We're going butt hunting every night. You know what I'm saying? So we want to grab our wife's butt every night, right? You know what I'm saying?
What happens
don't
when the
butt
guys
hunt.
take over
No,
our
you
show?
know what I mean?
Yeah, look at this.
Yes, you want.
But
Okay, get
that
out of
is
here.
totally not.
No, we're saying.
What's not appropriate?
What's
What
up,
were you
probably-
just
Why?
doing?
Because we.
Butt hunting.
Yes.
Butt hunting. Okay, I'm used to the
So
other.
so the idea.
No, it didn't go like this.
No, but we love our wives. So
We break away for a commercial.
No, let's talk about this. Let's
coconut
talk
oil.
about this. Let's talk about
Our
this.
coconut oil
Okay?
ad.
Here's what happens. Think about this. We gotta talk about this. People need to hear this stuff. If you think about it this way, it's like I look at my beautiful wife. My testosterone goes through the roof. I want to touch her. You understand? We talked about this weekend, didn't we? We talked about going, because we're with our wives, and we're like going, oh man, we can't get home. We can't wait till we get home. Why? We've been away from our wives 3 days. You understand? So we're
Yes.
thinking about our wives, and it's like, and I'm texting beautiful stuff to my wife, honey, I miss you, I love you, because I do dearly.
because you care so much and you have such a soft heart.
And all
Sorry, Nancy.
he was able to do was spend the night
that-
with me.
that's
That's right. And it's like, and Ross is my best friend, but he's not my wife.
Yeah, there's no
Do you
butt hunting
understand?
going on here.
Oh, that's
He is
what's
your
wrong.
work wife.
He's my work wife. Yes.
He
He's
does
my
your
work-
ironing.
He does my.
He does all of our ironing.
He does all of our
He
ironing.
ironed. Yeah. See, what are you talking about? We're in
That is
Hawaii and stuff of that. And Bree calls me and
Nashville.
says,
No,
is-
Nashville.
or Nashville. Bree
Where's
texts me and
Ross?
goes, "Where's Ross?" I'm like, "Oh, he's just ironing my clothes. Can you send him over to me and iron after?" Because he does. He does great iron. He loves it.
Good at
okay.
ironing.
It's a really sad day when I have to be concerned about how our organization presents itself. I want iron clothes.
Yeah, he does. That's his
That's true.
detail.
It is kinda
he's,
his
he's
thing.
he's very good detailed that way. So, but anyways, long story short, it's like, so I'm away from my wife for 3 days and things like that, and it's like, yeah, listen. So I'm gonna do everything I can, set it, tell how much I love her, which I love dearly that way. It's just that no joke though. But without the sex, guess what happens? Guys aren't gonna tell their wives they love them that much. Because telling us our wives we love them that much, to them it's emotional. To us, it's not. Do you see that?
I'm so not you.
Yes. Get out of here.
Yeah, you
No,
gotta remember,
so
you got Mr.
Yes.
Golden
I'm
over here.
emotional. Tell me you love me.
Yes, but he has too much estrogen. Trust me, I've tested
Oh,
him.
really?
You, out of here. Okay. So,
Mr.
Yeah. Yes.
Now he goes.
Yeah.
So what does she do if her husband is sick? How does she tell him to get tested?
It's going to sound
She
horrible.
says-
It's going to come to an ultimatum.
Yeah.
Because think about this woman. This woman, think of it this way. When a guy disconnects from a woman, the thought process of a woman now goes to bad places.
Right.
Is
He
there
does.
another woman? Does he love me? Am I going to be with him in the future? Blah, 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 blah.
And then she'll start disconnecting too.
She'll start
because of that.
disconnecting, and that's where things start. Instead of saying, honey, there's got to be a problem. And see what happens is she has to approach him and say, listen, this is getting bad. And a woman can't live disconnected from their man. If they live disconnected from a man, it'll make them sick. It'll make them mentally just stressed out like crazy. And it's bad things. I didn't realize, for example, when I didn't understand all this, I put my wife through a little bit of hell. Hey guys, listen. When I was learning stuff, I didn't understand this stuff either until I really, but being a clinician, I started listening to women and started going, I'm like, you think I'm joking? You ask my wife. I've walked up to my wife and say, I'm sorry. Do you know I'm sorry? Because I didn't understand. And they say, well, doc, but how'd you figure out? I started looking at labs and going, what's going on here? What's going on here? That way, I'm going, holy man, because I did well when I first started practice. So I put my heart and soul into growing a practice that way. And my excuse was, well, honey, I'm providing for our
Working,
family,
yeah,
this.
right.
And I didn't realize that I was actually creating a disconnect. Yes, is it nice to provide for your wife? But why couldn't I provide and offer the other part to actually make sure she's not disconnected? So if a woman is going to get to the point where she's going to feel so disconnected, she's going to be done.
Right.
Done. And she
So,
said,
so approach it before it
gets
too
there.
far gone.
Because people
Right.
say, no, she loves Jesus and she'll stick with him. Yeah, I see a lot of women that love Jesus and end up in another man's arms. You know what I'm saying? Because why? And they struggle because what happens is people think that guys are the only ones when they're that disconnect and chase after a woman. Women, you start disconnecting, guess what happens? I don't care if you're a great provider or anything, that woman can't leave without connection. And all of a sudden someone goes up to that woman and says, hey, you look pretty today. And one goes, and her hormones get stimulated,
Right.
and guess what happens? Then that woman will start to get attracted to a man, and even if it's a good Jesus-loving woman, she's gonna have that internal battle. And I sit there and I sit across, and you think, Dick, how do you know this? Because I've been sitting across in consults for women for
Right.
20 years. And that's why when I started teaching, I taught one seminar and it exploded, and people were like, God, teach this. I'm not a speaker.
No.
I'm not. Yes, I'm good at it, but I'm not a speaker. I'm a clinician, and that's what I'm trying to. That's why I love this show. It's like, listen, take care of stuff, but it takes two. Took two to make a baby. Takes two to take care of the vagina. That's a good quote.
Takes two. That's a good quote. Put
Let's
that
ha-
on Instagram.
That's right. That's right. I know.
And
I
sell
come up
some
with the
coconut
coolest
oil.
stuff. I know.
So
awesome.
on that note, we'll lead into what next week looks like.
Yes.
Is it next week? No, 2 weeks from now. Next
No.
week?
Next week is the 12th. I don't have
No,
my
no.
phone.
We'll be in Hawaii the week after that.
Yeah, so while we are in Hawaii, Nancy and Nicole are talking about birth control options.
Nice.
Yeah,
Because I hear
be
from women
interesting.
all the time, my husband won't let me get off birth control. And, I could go on that so
Now,
And
Can I-
that's,
can I
and
leave-
that's
really
funny
long time
because Bree has a lot to say about that, but
I've come
you're
up,
not going to be here.
I've come up with the best form of birth control. I'm going to give the analogy, and I'm going to let Nancy teach it in 2 weeks from now. So you got to tune in. It's
No,
called
no,
the
no.
SDU. Remember that SDU? Ask Nancy on the show 2 weeks from now.
SDU.
Talk to you soon.
What?
Bye bye.
Let's go with something else.
What is it? Are we still live?
Yep.
What is
Yep, he
it?
says.
SDU.
I was thinking about something else.
I'm thinking about my sweatshirt. That's good birth
Anywho,
control.
Thank you, Dr.
wearing a
Patrick
hoodie.
Flynn,
Thank you, Dr. Patrick.
for being on the show and taking us down all kinds of avenues. But I think it's important for moms to know, gosh, the options out there. It's we live in this bubble.
Yeah.
And I forget that people don't know that there's
That there are
options.
options. And I mean, just along the
And
lines
they're-
of hormones and how you feel after having a baby, and if you just don't feel quite right, just remember that you can get them tested and find out
Yeah.
if you're normal.
Yeah.
Because just because it's common doesn't mean it's normal, right?
Yeah.
I mean, even I know that starts to sound cliche because we say it so often, but it's not normal for that man not to have a sex drive. You
And
know?
it's not normal just because moms joke about 3 to 6 years.
Right. Right.
doesn't mean that it should be 3 to 6
Right.
weeks. We kid.
We kid.
Because we kid.
Because we're
But-
fun.
Because we're fun.
We're trying to convince ourselves that we're fun.
We are fun.
moms, but
Yeah. Are we live?
yeah,
we're
I think we're still
live.
live.
So,
But
we'll end on
anyway,
that.
get tested if you have,
And
yeah.
Next
and
week,
then
maybe next week we're talking about your birth control story.
my phone died,
Your phone
and
died.
I can't look to see
So
what
you didn't
we're
properly
doing
prepare
next.
for the show. You didn't bring your
No.
coconut oil to the table or your charger.
And I don't have a charger.
No, but it is.
But
I think we're
I
talking
think
about.
mine is after the birth control.
Okay, I'll have to take a
But
peek.
anyway,
But either way, I
yeah.
know in 2 weeks
Yeah.
when I'm gone to Hawaii, you and Nicole are talking about birth control and different options.
Yes.
For when you do get the hormones right and after the baby is here, because you will get pressured by the doctors. Are you ready for birth control? Are you ready for
Yeah,
birth control?
and maybe
Are you
even
ready for
pressured
birth
from
control?
your spouse
So
of
yeah,
wanting
And
him
why
wanting you to get on something.
I would advise that a synthetic form of birth control. I'm not saying
Right.
birth control is bad because condoms are birth control.
Right.
But synthetic forms, I would stay far, far away.
So we'll talk about that in a couple weeks. We'll put out a reminder of
Yeah.
what next week is, and then I think in a couple weeks I'm going to share my story, birth control / baby birth. So
Yeah.
that one will be interesting too.
Awesome.
Not quite as lighthearted as this one, but
But
it'll
good
be good.
information.
Yeah, it'll be good information. So thanks for watching today, and I hope it was entertaining and informational. That you got some good information about when you can have sex after baby and what's normal and what's not.
Yeah.
Right. So we'll see you next week.
Awesome. Bye, guys.